Hey guys, it's Dr. Webster. I'm here to talk about retainers. I get this question all the time about what kind of retainer is best. And the answer to that is there is no superior retainer. Every one that has its pros and cons. There's three types. Two are removable and one is fixed or glued onto the person's teeth. So I'm going to talk about the one I don't like the most, which is the glued on one, or they're called the fixed retainer, or a bonded retainer is another thing, or permanent retainer. Some people call it permanent retainer. It's basically a little wire that gets glued onto the back side of your teeth. And I don't like it as well as the removable kind for a couple of reasons. One, you can't take it out. I don't have a permanent retainer, that kind of retainer in my mouth. The reason why I don't is because I don't want something glued onto my teeth if I don't have to have something glued onto my teeth for the long term. Biggest problem is because you can't take it out, it's glued on. If you eat something hard or something goes on that breaks it, now you got a broken retainer. A lot of times that means because it is a wire, it can poke your tongue, it can poke your cheek, it can poke your gums, and just like having braces. A lot of times though, when it breaks, you don't have any of those symptoms and you don't even realize that it's broken until you see teeth shift. The reason why you don't see it's broken is because it looks like it's still intact with the teeth. But then over time, because you don't notice that it's broken, you don't get it addressed, you don't get it replaced or fixed, teeth start to shift. At that point, we're not talking about replacing the retainer. We're talking about possibly doing some braces or Invisalign again to get those teeth straight. The removable kinds, you can take them out of your mouth, you can kind of see if they're broken, and you can get them replaced before teeth start to shift. So that's the first thing. I don't like it because it can break, and if it does break, you don't know if it's broken until teeth shift. The other reason I don't like the fixed retainers is hygiene. These are food traps, just like braces. So they're going to trap food easier. It's going to be harder to clean. Most people that have them have a hard time flossing. Some people don't floss, and because they don't floss, they get gingival disease, gingivitis, sometimes bone loss in severe cases because they just don't do it. It's too hard for them. Another thing with hygiene is the hygienist and the dentist, when you go for your cleanings and exam, they don't have access to clean those teeth as well. And so they're either not going to clean them thoroughly, they're going to possibly get too aggressive and maybe break them off, or they're just not going to have access to clean everything, so you're not going to get as thorough of a cleaning. The other thing is it's only in the front part of your teeth. This permanent retainer does not go to the back to your back of your teeth, so you don't have retention or any kind of stabilization in the back. Those are the main reasons, and that's why I don't like it. Obviously, the advantage of having it is you don't have to be responsible to take something in and out of your mouth. You don't have to put it in your purse, or in the case you have to carry it with you, take it out in a restaurant, and it's kind of embarrassing or whatnot. And you don't have to just worry about it because it's always glued on. Let's go into the other types of retainers, the removable type. There's two types for that. I have both types. I think they're both great, but they do have pros and cons. The first type is the type that usually people don't use very more. It's called a Holly retainer, or we call it an old school retainer. It has acrylic. The pink part's acrylic, and then there's a metal part. These are really good, but they're not as practical. People don't have as much of a tendency to wear them, and it's because there's metal on the outside, so they've either had braces for a long time or Invisalign. They don't want to still have something that shows a metal part in the front of their teeth, so they don't wear them because of that. The other thing is because it's so rigid, this material is a lot more sturdy than the plastic. That's the other type of retainer. And because it goes into the roof of the mouth sometimes and around the tongue, they're not as comfortable. And so people don't wear them as much because they lisp or they gag or, something, it's not as comfortable. So they don't tend to wear them as much. Or there's a harder time wearing them. These kinds are actually better clinically than the clear ones because they don't have plastic that goes over the teeth. The teeth are allowed to kind of settle in, but they're not very practical. Like they're not, most of the time that people they have a hard time wearing them. The best kind of retainer is the clear one that I use for most of my patients. It's the modern type. It's removable, so you can take it out when you eat. You don't have to break it as much. It is plastic, so it's not as strong as the other type. But it's clear, so it's very aesthetic. People don't know that you have a retainer in when you have it in. You can floss by taking it out. All the advantages of a removable retainer is part of this, plus you get the aesthetics, and the comfort is a lot more too because the plastic's a lot less bulky than the other type. So hopefully that answers your questions. Leave any questions you have, and I will see you later for the next orthodontic topic. Bye.